Hey everybody, it's Chuck Freeby, and it's great to be with you on Open for Business as we bring in Brian Mounts. And Brian is involved in a lot of things, including the Alcohol and Addiction Resource Center and the Drug-Free Partnership for St. Joseph County. So welcome to Open for Business. And let's start with that first one, the Alcohol and Addiction Resource Center. What kind of resources are available to people who find that either they or a loved one has an addiction?
Well, thanks for having me, Chuck. At AARC, we offer sort of a multi-tiered approach to helping individuals in our community and families as well. We do prevention education throughout the community. We use evidence-based programs, partnerships with other social service organizations, social media campaigns to reach the masses and deliver a message about how to live substance-free and how to avoid going down the road of addiction. Now, for those individuals and families that are already in the midst of that, we provide different services to assess where they're at and to potentially recommend treatment or some sort of path to recovery for those individuals and families as well. We also are a walk-in resource center. So people can come in off the streets and find information about a wide variety of substances. We've got brochures, pamphlets, literature, and individuals who are willing to talk to them and answer whatever questions they may have.
And you mentioned the families as well, and I think that might be a forgotten piece lots of times. We think of the individual who has an addiction and they're getting help, but that family has typically gone through a lot too. What kinds of things help them out?
Well, the thing that I always tell people is no one prepares themselves for how to deal with a loved one who is dealing with addiction. You only learn about it when you're in the middle of it. So when people are dealing with a loved one who's struggling with a substance use disorder, they have 1,000 different questions. What can I do to help them? What resources are available? What is treatment? What does that even look like?
Right.
How do I pay for that? How does that work? And so we're able to kind of break it down and help them step by step and navigate some of those murky waters of what to do. And different substances look different as well. So how we treat that individual as far as getting them in and getting them the treatment that they need varies from substance to substance. And a lot of times family members and individuals don't always know what they're supposed to do to help their loved one. So we help them with that.
And you brought up one of the magic words, which is pay, because I imagine when people approach you, they think, okay, well, how much is this going to cost me to use your service? And what are the further costs down the line?
Yeah, and from our perspective, on our end, it's fairly cheap. I mean, we have a set fee for the assessment process. But when it comes to sending someone to treatment, it's a completely different ballgame because each facility is a little bit different. Some accept insurance, some don't. Some accept Medicaid, some don't. Some cost tens of thousands of dollars, and some are a little bit more affordable. And that's important to everybody, how much they're going to pay. I mean, we all want to get our loved ones the help that they need, but you don't want to put a second or third mortgage on your house to make it happen sometimes.
Sure. And the key here is not just alcohol, but addiction. So you're dealing with drug addictions as well. What kind of drug addictions are, I don't want to say more popular because it makes it sound glorified, but the things that are perhaps affecting the community the most these days?
Well, besides alcohol, we're definitely seeing a lot of continued opioid use and abuse and overdose. Not all fatal, but a lot of overdose fatalities and overdoses based on heroin and opioid use as well. We still see a lot of meth in our area, and we're seeing a lot of marijuana use now too. And the thing about marijuana is that, it's not the marijuana from 20, 30, 40, 50 years ago. The THC levels used to be 2-3%. Now we're seeing it upwards of 60-70%.
Wow.
So it's a very high potent THC content that people are getting with the marijuana, which has different effects than what it used to be. So I would say that marijuana, opioids, heroin, and alcohol are probably the ones that we're seeing the most.
Well, the good news for your agency, and hence for the rest of us, is that you're part of a partnership for a drug-free St. Joseph County. How does that work? What kind of collaboration goes on there between different social agencies?
We've always had a really strong relationship with the partnership. AARC has always served in a leadership capacity with the partnership. So we've always been there hand in hand with them. But we have 50 to 70 individuals and organizations that are involved in the partnership. So it's really all about networking and bringing together different individuals and businesses that are trying to tackle issues related in general to substance abuse and addiction. And it can be social services, it can be law enforcement, it can be the health field,
Sure.
doctors, nurses, the different health facilities in our community as well, business owners, anybody who is dealing with substance use on some level.
Is the benefit from this just creating an awareness in the community? Is that what that collaboration is trying to do, besides obviously prevention?
That's a big part of it, but we're really trying to look at measurable outcomes.
Okay.
So we do an annual comprehensive community plan where we look at the issues that we're dealing with in our community related to substances, and we try to figure out targets for how to decrease that. So we might have a 5-year plan for how much we want to decrease underage drinking in our community. So through different programs and raising awareness, we're trying to check those boxes to actually make a difference in our community.
And when you talk about measurable outcomes, give us some success stories. Where have you been successful with that?
You know, we see a lot of progress across the board. And one really good example is just looking at a decrease in overdose fatalities. Pre-COVID, around 2016, 2017, in St. Joseph County, we were seeing about 100 overdose fatalities a year related to heroin and opioids. Mm-hmm. Before COVID, we had gotten that number down to about 56, 57 a year. So not quite 50%, but close. And then unfortunately, COVID, we saw the numbers kind of spike again, but now we're starting to hopefully see that decrease as well. So between having Narcan readily available to help save people's lives, raising awareness about the dangers of fentanyl and opioids and misusing prescriptions that don't belong to the individuals, we can see very clear measurable outcomes in fewer fatalities.
Well, Brian, let's give people a couple of websites to look at so that they can be in contact with your organizations. If you're interested in the Alcohol and Addiction Resource Center, that's AARCinfo.org. And if you're interested in the Partnership for a Drug-Free St. Joe County, that is thepartnership, sjc.org.